everyone, I'm Dr. Christina Hahn, Medical Director at Zion and also board certified dermatologist.
And I'm Lily. You'll know me as the head editor of the Zion Health Medical Library. And today we've got a really interesting topic to discuss for you. It's actually finasteride, which is one of the most well-known and clinically proven treatments for a condition called androgenetic alopecia, which you may know better as male pattern baldness.
In recent years, we have heard reports about something called post-finasteride syndrome, which has raised alarm bells for some clinicians and patients. So we'll discuss that today.
We'll tell you all about what exactly this mysterious syndrome is, whether you should actually be worried about it, what you should do if you think you might be experiencing it, and whether it's actually even a real condition.
So what exactly is post-finasteride syndrome? Well, a syndrome is essentially a group of symptoms that can occur together, and in this case, it can include sexual as well as neurological and or sometimes even physical symptoms, and has been thought to be tied to changes in androgen hormone levels. The symptoms can actually start anytime during the course of finasteride treatment, but the key is that these symptoms can last well beyond discontinuation of finasteride.
So how many men globally have post-finasteride syndrome anyway? It's actually really difficult to know the exact incidence, but it's estimated that anywhere from 5,000 to 10,000 men globally have reported this particular condition. But it's really important to keep these numbers in perspective as well. Although several thousand men sounds like a really daunting number, the reality is that many men are able to take the medication without experiencing any issues. And in the grand scheme of things, it's actually still a very rare condition.
So what are the symptoms of post-finasteride syndrome? In general, the symptoms of post-finasteride syndrome do relate to the side effect profile of finasteride. Main key here, though, is that the symptoms do not tend to dissipate or improve even with discontinuation. As a reminder, the side effects of finasteride can include erectile dysfunction, changes to sex drive, reduced sensitivity to sexual stimulation, ejaculatory changes or disorders, breast swelling and or pain, chronic fatigue, muscle aches and spasms, memory problems including feeling sluggish, depression, anxiety, trouble sleeping, and in very rare cases, suicidal ideation. The vast majority of cases do tend to subside over time and do tend to actually mostly start early in the course of initiating treatment.
A lot of people wonder how long post-finasteride syndrome actually lasts. And that really is the core of the issue, is we don't know in some cases how long someone's going to be dealing with their side effects. But just to reiterate a point that Dr. Hahn just made, the vast majority of people will find some relief from their symptoms as long as they power through it and they just give them a little bit of time.
And in terms of whether post-finasteride syndrome is even real, well, that's really truly the million-dollar question. There are clinicians out there that debate even the reality of the syndrome. And, ultimately at the end of the day, I'm a doctor first and I always put my patient safety first. So really reporting any side effects is very important and taken very seriously. At this stage, there is really no conclusive evidence that there's a direct cause and effect relationship with finasteride and post-finasteride syndrome, and there really isn't clear diagnostic criteria. More research really needs to be done, and much of what's out there is anecdotal and self-reported from patients.
And just to build on a point that Dr. Hahn just raised about self-identification and the key role that it plays in the incidence of post-finasteride syndrome and the types of symptoms that people are reporting, there have actually been studies that have found that if you warn someone about the possible side effects of a medication, it might actually affect whether they experience them or not in the long term. So that's something that's actually really important to keep in mind. Also, in the specific case of finasteride, we do know that some of the most commonly reported side effects are sexual in nature. And it's really important not to forget that when you're dealing with sexual side effects, there's both a psychological and a physiological component to experiencing them.
So what do you think you should do if you think you have post-finasteride syndrome? Well, first things first, it's really important that you talk to your doctor about it because really you want to make sure that you manage these symptoms properly. As well, if you want to manage the hair loss, you may have to consider other treatment options if side effects with finasteride become an issue. If you'd like to consider 5-alpha reductase inhibitors as well, you can still consider topical formulations, as there may be reduction in absorption of the active ingredient into the body and thereby reducing the possibility of side effects, including sexual dysfunction.
At the end of the day, it's really important to be literate and to be aware of the potential safety risks associated with any medication that you're taking, but equally important to make sure that your doctor is involved in that process and that you're informing them whenever you're experiencing side effects. At the end of the day, finasteride is still the gold standard when it comes to treating male pattern hair loss. And really important to remember that many men are able to take the medication without any issues. Ultimately, decision to take any medication is yours. No one can force you to take it, but we just want to be here to support you and make sure that you're making the most informed decision that you possibly can for yourself.
And that's it for today. Thank you so much for joining us. Hopefully this was very informative, and until next time.